Good afternoon, and thank you for joining us for today's webinar for 2021 GLS applicants on how Kognito can meet grant requirements. We're happy to be able to share today's presentation with you all as you prepare your upcoming grant applications. Before we get started, I have just a few housekeeping items to run through. Today's presentation will be recorded, and a copy along with the slides will be sent out to all registrants. Attendees are in listen-only mode. However, if you'd like to chat with us or ask a question, you can do so on the right-hand side of your screen in the GoToWebinar control panel. Finally, we invite you to connect with us on social media by tweeting @Kognito or using the hashtag #CognitoWebinars. During today's presentation, we'll be briefly discussing the goals of the Garrett Lee Smith Campus Suicide Prevention Grant Program, giving you an overview of Kognito's online prevention simulations, outlining how we support the required grant activities, as well as the added benefits of using Kognito to meet those requirements, and concluding with a brief demo of Kognito's at-risk mental health for students before moving into Q&A. I'd now like to introduce today's presenter, Dawn Bornheimer. Dawn is a published author and industry leader with a unique combination of interpersonal communication skills and professional development with a focus on education and social impact. In her 18 years of professional experience, she has worked at Johns Hopkins Bayview Medical Center in their psychiatric rehabilitation program, taught for 5 years in the Baltimore City public school system, and facilitated business development initiatives for Kaplan Test Prep, Capella University, and NYU Langone Health. She joined the Kognito team in March of 2019 and serves as the Regional Director of Education Partnerships, overseeing clients in both K-12, higher education, and healthcare. Dawn, take it away.
Thank you, Scott. Thank you, those of you that are joining us today and those that are going to be listening to the recording later. Before we get started talking about the grant, I just want to acknowledge the type of year that you guys have been navigating and recognize that everyone has been moving through this the best that they can. And we are so grateful for your time and continue to look forward to supporting colleges and universities across the country as you look to meet the needs of your students, faculty, and staff. Next slide, Scott. So we've outlined for you the requirements here of the Garrett Lee Smith grant. The purpose of the grant to both develop and create a collaborative effort on your campus to give you the opportunity to make a sustainable approach towards addressing mental health services, substance use prevention, and taking a look at reducing risk factors and improving protective factors within your campus community. By being able to identify these resources and create this culture of connectedness and belonging for your students, we anticipate that you will see a great growth in not only their community connectedness, but also their opportunity to self-regulate and to seek help as needed. And so the trainings that we have to offer are going to be focused on both recognizing signs of distress in another person, as well as the opportunity to self-lead and request support from various campus services as needed. So we've outlined a few of the key dates for you to be mindful of and the number of awardees that are going to benefit from the Garrett Lee Smith grant. Kognito historically has served over 50% of the grant awardees, so we're excited to see how many of you we can serve again this year. The links inside this presentation are going to be made available to you. So after we wrap up, we're going to make sure that you receive a copy of this deck. So all of these hyperlinks will be accessible. But we want you to know that over the course of 3 years, we'll be able to build a partnership that will allow you to create this safe and connected community with the use of the Kognito simulations. And with the help of the Garrett Lee Smith grant, you'll have the opportunity to fund that 3 years with Kognito and really create a sustainable path forward. So at Kognito, we use the combination of science of learning and the art of conversation with the power of virtual human interaction, giving you the opportunity to improve social, emotional, and physical health with your students, faculty, and staff on campus. So within our student wellness and campus climate programs, we do offer the opportunity to build conversation skills across various topics. The topics that we support are listed here, all of which we have research proven approaches to communicating these skills. We offer the private practice environment. So the Kognito platform is an experiential learning platform that gives students, faculty, or staff the opportunity to engage in these conversations, select from conversation pathways, and build the skills to use conversation techniques such as motivational interviewing, empathic accuracy, and emotional regulation. The goal of promoting healthier behaviors amongst your campus community while reducing risk factors and harmful behaviors. The topics that we cover are listed here. We focus on mental health and well-being, sexual misconduct prevention, military cultural competency, and alcohol and other drugs. For the sake of this grant and this presentation, we're going to focus on those that meet that criteria. Many of the schools that we partner with select Kognito for many reasons, but we've outlined a few of them here. We offer a practice-based environment, so a safe learning environment, which allows for a client, a student, or a faculty staff member to engage in a dynamic learning experience, offering them a safe learning environment to create mistakes and to learn these evidence-based conversation skills. All grounded in research and neuroscience, we're able to measure the impact of the completion of our simulations. So using surveys, we put in a pre-survey to check in about the confidence and self-efficacy around these skills. We have the students complete a post-survey after they've completed the simulation. How are they feeling now? Do they feel better equipped to engage with their peers, to engage with others in their community, that they recognize signs of distress in? And do they feel that they feel more empowered to seek support for themselves? And what you'll see later on in the presentation is some of the updates that we've done for the mental health student component, where we've introduced resiliency and self-care skills. So we're very proud of the updates that we've made during the pandemic, and they've been very well received in the communities that we serve. Taking a look at how scalable this product is. Right now, some of you are in a remote learning environment, some are doing a hybrid model. So you can be confident that Kognito is accessible to all, and it's accessible in the environment in which you're serving right now. A fully online solution that has been built in concert with subject matter experts to ensure that we're providing the best conversation techniques as well as the best tips for building these relationships within the communities. We do have a growing body of evidence that supports the virtual human interaction as a great way to build confidence and self-efficacy and to ultimately see behavior change. The goal of any training is to have it implemented in such a way that it empowers the individuals that complete the training to actually change their behavior, and we're able to measure that. Inside this deck, we have given you some information around some of the articles that we have published. The research shows that this evidence-based conversation technique, the platform, and the opportunity to engage with emotionally responsive avatars, virtual humans, gives you the opportunity to also see what it would be like in a real-life conversation to engage with somebody who may be looking to share what they're moving through at the time, but perhaps the different ways that you choose to engage with them, the types of questions you ask, reserving judgment, remaining neutral in certain statements, allows them to feel less judged, and in turn will open up the conversation dialogue, allowing you to understand a little bit more about what they're going through. And so these pieces of evidence are showing you a little bit how they were implemented in different places with our clients, and then of course just the evidence to support that you can see behavior change through the implementation of Kognito. So we've taken the time to outline the requirements for the grant specifically. We've taken a look at the grant requirement and how Kognito meets that grant requirement. So I will go through a few of these just so that you have the opportunity to see them. But again, we're going to provide you with this deck that will allow you to complete your grant application more thoroughly. So taking a look at training college students and faculty and staff to respond effectively, focused on both mental health and substance use. We are meeting that requirement by including both training programs that are tailored to the learner. So one of the beautiful things about Kognito's platform is we meet the learner where they are, It is delivered with fidelity as it is an online simulation tool, and there's unbiased coaching available within the simulation that you'll be able to see in a few minutes, offering the opportunity for the learner to be gently nudged in the direction of the next right decision. And by making a certain number of consecutive correct decisions, they will navigate their way through the end of the simulation. This is a safe, healthy way of learning these skills that feels less invasive and doesn't produce as much anxiety as perhaps an in-person training would. When we take a look at the outreach services and providing college students with the available mental health support that they require, we provided materials that will assist institutions in the outreach to their communities. So we want to move from individual responsibility to community solution, and the Garrett Lee Smith Grant and Kognito support those initiatives. When we take a look at the requirement around educating and disseminating information materials, Kognito has the opportunity to offer you the skill building practices that are required to build the ability to recognize warning signs in another person. We also create the visibility that's required to get the adoption and the implementation that you're seeking. So in order to change the culture, we need to make sure that we really have a deep penetration of your community. And so we're going to provide you with marketing materials that are going to help you to ensure that everyone knows that you have access to Kognito, and in fact to encourage implementation. We've seen some really creative ways that universities and colleges are implementing Kognito to include psychology classes, maybe substance abuse or recovery courses. Collegiate recovery programs will be very helpful to you, athletic programs. It's really important to get a collection of stakeholders on your campus involved in the implementation. And that's how we're going to build that community and that safe culture. When we take a look at conducting research, for those that are interested in taking a look at measuring the referral process and taking a look at who is completing the simulations and how is it impacting their ability to show up more fully for the academic experience, we are going to provide you with those pre, post, and follow-up survey data sound bites. So you get qualitative and quantitative data back from Kognito. That's really going to be a good information tool for you to be able to see what impact you're truly making. And our client success team, you're going to have a dedicated account manager that's going to support you. We'll review those on a quarterly basis with you. When we look at the requirement around supporting college students and groups on campus, including these athletic programs I mentioned, taking a look at reducing negative attitudes and reducing stigma, we want to focus on how do we support that metric. And so the reducing of stigma is really important and something that is addressed in the didactic components of our simulation. But if you think about everyone having this shared experience of completing a Kognito simulation that's built for them, you have the opportunity to also acknowledge the collective initiative that's being put forward by the university or college. You're able to say, this is important to us, and this is one of the tools that we're going to be bringing to you to give you more information on how to show up more fully for yourself as well as for your peers. And so we have the opportunity to do that with the at-risk simulations around mental health. We've seen some really great initiatives from sororities and fraternities, in addition to collegiate programs, and then the general population as well. When we look at developing and supporting evidence-based and emerging practices, we feel very confident in both culturally and linguistically that we are meeting that need with Kognito's evidence-based simulations. We have had them peer-reviewed. We have some different publications that could be of very good interest to you. And certainly, in addition to the links I've already provided earlier in the deck, we'll make sure that you have opportunity to see more of what Kognito has to offer by connecting you with your local representative. The higher education suite includes cultural competency for veterans specifically, and so many of you have student veterans on your campus that have unique challenges, and we want to make sure that faculty and staff as well as peers are prepared to engage with those student veterans, knowing that they are also going to need support during this time. When we want to create a network or an infrastructure that links to the institution, when we think about how do we create this and make it a sustainable culture so that not only do our stakeholders see that we're fully vested in reducing these risk factors on our campus, it's the opportunity for us to take a look at how do we really shift the behavioral health culture on your campus, making it okay to not be okay, making it okay to need support. How do we support and empower the student groups that are focused on mental health, like Active Minds or the JED Foundation? Those of you that are partnering with Together All, there are some really great partners that Kognito has that are doing some great work to build out the infrastructure, and Kognito will love to be a part of that. With our resources page within the simulation, we give you the opportunity to customize that section. The customization of that section lets you point students, faculty, and staff directly towards the local community resources such as the counseling center, telehealth, if you have a partnership with a telehealth organization. What are the phone numbers, email addresses, websites that they need to hyperlink to? Within the simulation, that resources section will be customized. And so you have an opportunity to call forward all of those partners you have in your community. And our dedicated account managers can also give you some suggestions on how other campuses are using that feature. We also take a look at the operating hotlines and promoting linkage to the National Suicide Prevention Line, which Kognito does. Again, we link that through the national, through our local resources section. We will encourage you to keep that information front of mind for students. So often we get questions about reporting. People want to understand that what does the Kognito report look like, and it doesn't meet the requirements for the Garrett Lee Smith grant. So the answer to that is yes. We've actually worked on what we have listed on our services tab as a custom GLS report. This report is designed to meet the demographic criteria, allows you to report out quarterly, which you're going to be required to do, and they are available to you through an admin portal. You're also going to have access to that client success manager that I mentioned. That person is also going to help you interpret those data reports and make sure that you have everything that you need. But we have built that report specifically to ensure that it meets the criteria so that you can feel the ease of exporting that report and using that to report back to SAMHSA. So the built-in surveys, this is a really great opportunity to understand what people are saying in your local community. So it's great for us to share case studies and share information and for you to read about other communities, but it's most important for you to hear what your students, faculty, and staff are saying. And so the embedded surveys are designed to do just that. We're measuring self-efficacy, the likelihood to engage based on your now acquired knowledge from completing the Kognito simulation, and perhaps seeking additional support and additional resources in your community after having had this experience with Kognito. So if you think about Kognito as a foundational skill, once everyone builds the muscle to recognize that it's okay to have these conversations, they may seek out their local Active Minds chapter. They may seek out a peer to have this conversation. They make an appointment on campus or through a telehealth service to connect with someone to share what stressors they're experiencing. And what we have the opportunity to do with these surveys is to measure that behavior change and also capture anecdotal feedback on a moment in time where they engaged with another student, a moment in time where they made an appointment, they took action based on the understanding that it's okay to do so. And the GLS grants have been around for a while, and what we do when we submit these is we also give you the opportunity to say, these are our surveys, this is the results, and if anyone is interested in research, we certainly can support that as well. So we don't just provide licenses and access to our simulation, we do offer implementation materials. Earlier in the conversation, I mentioned the marketing materials that we make available. Those are like flyers, but also we want to empower you to have discussions around the simulated experience, especially if it's going to be used in a class. And so we have implementation materials that extend to discussion guides or talking points, email templates. How do you communicate out to your school community that this is important, that you need everyone to engage, that you would like this to be either required or, encouraged? And how do you get widespread adoption across your campus, especially the larger universities? Oftentimes you take a look at how do you leverage those materials. And so we want to provide you with a great jumping off point for those materials. Some of our campuses will go ahead and modify a few things, some of it used just as it is. but it's nice to have a good jumping off point to lead thoughtful discussions around the student experience or faculty and staff experience with the simulations. And so we want to make sure that this is as turnkey as possible for you. And so when you're a partner of Kognito, you receive these materials as part of that package. So we also want to be mindful that we need to be as flexible with our delivery as possible. The good thing is Kognito's been working online since its inception. And so we did not transition an in-person tool to an online tool during the pandemic. We were built this way. And so we are flexible where you can deliver these simulations and in turn the method in which you do it. So there could be standalone online trainings, but we also encourage you to take a look how to be really creative. How do you use it as an opportunity to build off of something else you're already doing? And so think about Kognito as an opportunity to be complementary in times and supplementary in other times. How do we leverage this online tool that's fully accessible to make sure that your students have access to this information? And again, taking a look at curricular integrations is a really great way to make it sticky on your campus and have the opportunity for educators and different professors to get involved in the process as well. So the last thing that we're going to talk about in reference to implementation is really focused in on this community of support that we're going to provide you. So a lot of our clients come to us and say, well, we have to have a planning meeting and then we'll be ready. The good news is we have the planning meeting for you. So we come to you with an idea of where we think you need to start, but we're also willing to have conversation and just open the dialogue about what your thoughts are. But please don't feel that you have to have that meeting before the meeting, because we're excited to help you plan and share best practices. That dedicated project manager is going to work with you. That account manager is going to help you with the implementation. We're going to provide tech support. Some of our universities and colleges do take a look at SSO or LTI integrations as an example. The deeper integration allows you to own the data. And some of our partners just rely on Kognito to continue to host that information. So as you talk with your individual representatives that work in your geography, I would encourage you to ask more questions. Ask about those integrations, ask about the materials that support your rollout, and let's have a conversation around how do we get this completely and fully supported to save you guys some time on what you may have to do on the front end. And again, we're going to offer any training that's required for your staff. If you want to bring a couple key stakeholders together, we could host a webinar to support your deployment of the simulations. And then, of course, those reports that we discussed earlier. The reporting is going to be a key factor in meeting the requirements for the grant. So we want to make sure that you have seen some examples of that and then are prepared to access those at your discretion when it's time for you to make those quarterly updates. So now we're going to take a quick look at a couple of the products that meet the criteria for the GLS grant, and then I'm going to demonstrate one of those for you just so you can see how the simulation works. So at-risk mental health for students was recently updated. This is a simulation we've had for some time, but we decided in the spring that we were going to make some updates, and we moved forward with those, and it was launched in the summer of 2020. We took a look at how do we take the student representation and make sure that we have a diverse character set, make sure that we're really fully representative of the students that are attending your schools today. And so we improved our diverse character set. We also took a look at self-care and resiliency. So we wanted to make sure not only could students recognize signs of distress within each other, but could they really help each other to understand the importance of self-care, the importance of being able to seek support, and really strategizing around how do I do this well and do this for myself? What am I using today and what could I add to my routine so that I can feel better prepared to take on all the challenges that are presented at the university and college level? The next simulation that also meets the criteria is a newest simulation that Kognito is releasing called Alcohol and Other Drugs. It is a 60-minute interactive conversation, and it focuses on the normal experiences that a college student may encounter, taking a look at understanding social norms. When we are still living in our parents' homes before we move on to college, we have an idea of what college looks like, what it sounds like, what those experiences are like. And frankly, we get a lot of that from movies. We get that from social media. We get that from other sources. But we want to make sure that we normalize appropriate behavior, healthy behaviors. We want students to understand what it's like on a day-to-day basis and how to leverage refusal strategies as needed. How do they examine the risks of situations that they are putting themselves in or finding themselves in? And how do they recognize that in advance of being in that situation? How do they use that information to apply safe and more positive choices? How do they decide to leverage those strategies and perhaps even guide a friend towards making a better choice and allowing that to be okay, allowing that to be what they decide to do as a self-honoring decision, and ultimately practicing these behaviors so that they create a positive personal plan that says, yes, this is who I'm going to be when I show up to college. This is who I want to be in order to be successful both socially and academically. And it's okay to surround myself with people that also feel the same way. The last simulation that we're going to take a quick look at is Veterans on Campus. And Veterans on Campus focuses on the student veteran, understanding the unique challenges that a student veteran may face. As some of you may know, there is a very broad stroke that is encompassed in student veteran. We have reservists, we have active duty members. You're going to have some full-time and part-time students that are military connected, and their lived experience with the military can also vary, both branch to branch and just through their own encounters with the military experience. And so we want to be very sensitive to the different ways that they engage with experiences on an everyday basis, as well as the way they manage their stress. They have been trained to handle certain things in a certain way, and their willingness to admit that they need support or help may look different. And so how do we manage these classroom discussions? How are we sensitive to these students? How do we recognize and approach them in a different way? And although we can acknowledge that these conversations should happen at a private forum, irrespective of whether they're a student, veteran, or a general population student, but also how do we inform and stay connected to them? How do we build that rapport in such a way that they see us as a resource for them? And so Veterans on Campus is focused on that particular type of student and how you can best support them. So now we're going to take a look at the platform for the at-risk mental health for students. I'm going to navigate my way through the conversation for a few moments just to give you an opportunity to preview the simulation, but we're going to make sure that you have access to the simulation so that you can experience it for yourself as well. So I'm going to play the part of Jessie. Jessie is meeting with Travis. She went over to his apartment because she was concerned that he was posting some sad things online. And at this point, a few friends have reached out to him and he hasn't been very responsive. So she thought sitting across from him and having a conversation may be helpful.
What are you up to?
Yeah, I haven't really been hanging out with anyone, just a lot going on.
Yeah?
Oh yeah, I've got a ton of assignments due, tests to study for, so much.
Yeah, it's a lot.
And everything's piling up. Plus, work has been super busy and my sister has been really sick, so I have to pull extra uncle duty, and I've kind of had some drama with people lately, which isn't helping at all.
So when you click the talk button, you're going to have an opportunity to select from a few conversation pathways. I'm going to choose relate, and I'm going to go ahead and select the first option.
Sometimes I get tired of dealing with the drama too.
You do?
Yeah, like right now, a bunch of people in my class are all pissy because I guess I'm the only one who aced our last exam. So like, what? They're mad at me for doing well?
So at the bottom of the screen, you'll see a virtual coach, and this virtual coach is going to let us know that by responding in this way, we've given Travis the opportunity to recognize that he's not alone. It's often quite normal to feel frustrated with people at school. So Jessie's letting him know that she often gets frustrated too. So then we're going to go back to the talk button and we're going to make another selection to continue this conversation. So we want to express concern this time, and I'm going to choose the second answer choice.
I don't think I've seen you in class since Professor Brown wanted to meet with you. How'd that go?
Oh, you know, fine. She was all, don't text during class. Why aren't your assignments in on time? What's up with your attitude lately? Whatever.
Nothing about that group work day?
Well, yeah, that came up.
I was on the other side of the room. I just heard the end of it. What happened?
Well, nothing happened. No one in the group was stepping up to do the work, and I just had this feeling it was all going to land on me again. Then Olivia shot me this attitude, and some words were said.
Some chairs were kicked?
Just one chair. Look, I'm done playing nice with those slackers.
So I'm going to just check in with the virtual coach again and see what she said based on this last response from Travis. And we're just going to acknowledge that by remaining neutral, you have the opportunity to get Travis to open up and share more. So if we were to continue to navigate this conversation, we would want to build off of the progress we're making and getting Travis to engage and share a little bit more about what he's moving through. But for the sake of time, we're going to wrap up the demonstration right now and make sure that everyone has the opportunity to explore the simulations on their own time, along with the links that are provided in the presentation deck. I certainly welcome any questions that anybody has. I know that we are short on time, so thank you very much for your patience with us getting started just a touch late. If there's at least one question, we'd be happy to take that question real quick.
Great, thank you, Dawn, and thank you to everyone on the line. We've had a number of questions come in, but yes, in recognition of everyone's time here, we're just going to address just one or two of them. We talked a lot about the surveys and the series of surveys that users complete throughout the simulation. How can these surveys help me evaluate the program, and is it consistent with GLS requirements?
Yeah, so the grant guide that was on the second to last slide, if you could switch back to that screen real quick, Scott, we're going to provide you with access to this resource kit, which is going to have some answers to similar questions. But I can say that qualitative and quantitative data is going to be really important for you in completing the application requirements, which include that quarterly report.
Great, thanks. And the last one here is just how do I get more information about pricing and general assistance?
Yeah, so we would recommend that you send a note, if you can go to the last slide, Scott, right in this bottom left-hand corner. If you can send an email to info@kognito.com, or you're welcome to send an email over to me and I will triage it to the appropriate representative. But we have a dedicated higher education partnerships person in each region, and they're going to be more than happy to answer any specific questions that you have. They can help you with your application requirements and certainly can make sure that you have a proposal, which I believe will be required for you to submit so that you can outline the costs for implementing Kognito over the course of the 3 years of the grant.
Great, thank you, Dawn. I think that's all the questions we have today. I just want to thank everyone on the line once more. Hope this information is helpful for you in your grant application process. Dawn, if you have any closing remarks.
No, I just want to thank everyone for their time today. We are going to have 2 more webinars, one next week and one the following week. So if this one did not answer all of your questions, and or if you'd like to see the information presented or share the recording out or invite others to attend the future sessions to get this information, please have them go to our website and register for the webinar, and we'll make sure that you guys get the recordings. Thank you so much for your time today and have a great day.